Welcome. I'm WTOP Capitol Hill correspondent Mitchell Miller, and thanks for joining us for the discussion Medicare in 2025, New Affordability Opportunities in Part D, sponsored by Astellas and the Federal News Network. My guests today are Tony Gingerelli, the Director of Policy and Advocacy for the National Alliance for Caregiving, Julia Schreiber, the Director of the State Health Insurance Acceptance Program for the Maryland Department of Aging, Adina Lasser, the Public Policy Manager for the Alliance for Aging Research, and Jennifer Dexter, the Vice President for Policy at the National Health Council. Welcome, everybody. Thank you very much for taking part in this discussion. And I wanted to start more generally before we get into the nitty-gritty of a lot of big changes, obviously, that are coming for people related to Medicare and Part D. And starting with Julia, I just wanted to ask, what are some of your concerns as we move forward in connection with these changes, and more generally about concerns related to the aging population and people knowing what they need to do to take advantage of some of these changes?
Yeah, so I would say I think we can all agree that a big concern for older adults is the affordability of healthcare and managing out-of-pocket costs on what is commonly, for many older adults, are on a fixed income. So managing those costs month to month, and something that the State Health Insurance Assistance Program assists with is navigating the complexity of Medicare. So while a lot of the new programs and regulations are really fantastic to help make Medicare more affordable, it can be challenging to understand and keep up year to year and understand and navigate the different plan options as they evolve.
All right, and I'll move on to you, Adina.
Yeah, absolutely, and thank you so much for having me. Just as a little bit of background on the Alliance for Aging Research, we were founded in 1986, and we are dedicated to promoting healthy aging. And I think when it comes to this issue specifically, drug affordability overall is such an important conversation, and also access is such an important conversation. And so, we're really dedicated to ensuring that older adults not only can afford their medications, but also are still being able to access the ones that their physician is prescribing to them. So really protecting that doctor-patient relationship. And I think that some of the reforms that we're coming to talk about today are so important and such great steps in the right direction. And there's a lot more work that we can be doing. So, yeah.
All right. And Tony, you have your own area of expertise as well. I wonder how you see this affecting people that you've been working with and the policies that you've been looking at.
Yeah, absolutely. So a little bit of background on the National Alliance for Caregiving. We work to support through systems change the 53 million family caregivers across the United States. And one of the issues that's really important to them is making sure that they're integrated into healthcare teams. So we were really excited to see the Center for Medicare, through the physician fee schedule, add additional billing codes for caregiver training services, where healthcare professionals can now train family caregivers or bill to train family caregivers on how they can further support their care recipients. And then the other piece is healthcare costs. As my colleagues were saying over here, we know from a report from AARP that on average, family caregivers spend $7,200 in out-of-pocket costs on caregiving responsibilities, which is huge. So making sure that they have the support they need to make sure those are paid.
All right, thank you. And then Jennifer, these are issues that are only growing as we move forward with this aging population.
Absolutely. As my colleagues did, just to give a little background on the National Health Council, we are an organization that represents the organizations that advocate for people with chronic diseases and disabilities, including the aging community. Both Tony and Adina are member organizations. We also have representation from other aspects of the healthcare ecosystem, but the patient community drives and leads our positions. And I think in terms of where we are with looking at the future and issues that are arising within Medicare, I think my colleagues talking about affordability is absolutely top of mind for all patients, particularly those with chronic diseases and disabilities that are more likely to have higher cost. In addition, I think we've seen an evolution of Medicare. I've been around a while, long enough to see it evolve. And the growth of Medicare Advantage, for instance, and the complexity that has added to a beneficiary's ability to navigate, understand, get information, make good decisions. It works really well for a lot of people. It has problematic aspects as well for some people. And putting that all together and navigating it for patients to make sure that they're getting what they need when they need it and they can afford it can get really much more complex than it was even 5-10 years ago.
Right, and actually, I'd like to follow up on that because I was going to ask, and we can start with you. As you know, you can choose a standalone drug prescription drug plan or a PDP, or you can get, which would supplement traditional Medicare.
Yes.
Or you can get, as you mentioned, the Medicare Advantage plan, and you touched on this, but what are some of the things that people should know related to that, some of the pluses and minuses, if you will?
Absolutely. I think there are great pluses in Advantage for many people because there is some flexibility, and I think the private side of things sometimes can look a little further in advance in terms of preventative services and care and things like that in order to save kind of money down the line on more complex treatments. But it also has a for-profit incentive that can make it difficult for folks who have more complex needs or more expensive needs. It's maybe not tailored towards people who have some of those more complex needs. So it's really a very individual decision, and I think that's where I came back to the complexity of making that decision of what's right for you. And that's also going to evolve a lot. I think making sure that people are continuously looking at what do I need, where do I need it, and what they choose is very important.
All right, and that moves me back to Julia. I wonder if you could talk to me a little bit about just some of the issues related to helping people navigate through these different kinds of plans, because a lot of people just don't know about them or don't research them until all of a sudden comes that time and Medicare is here or it's a year away or whatever, and they haven't really done their homework yet.
Yeah, well, first we'll say that it's important to review the plan every year because plans can change. So as every year leading up to Medicare open enrollment, which starts October 15th, the plan that you're currently enrolled in will send an annual notice of change. So this is a letter outlining anything that might change in the new year. I would emphasize that Medicare actually has some really great resources and tools, so you can actually go onto medicare.gov and use the Medicare Plan Finder, plug in your medications that you're currently taking, maybe even play around if something you might anticipate taking, and see exactly how much your annual costs might be with the current medications that you're on. So it is important to think about what changes might happen, in particular with Part D plans. What pharmacy are you going to? Because there's different there are in-network pharmacies or even preferred pharmacies that might have some additional discounted costs. So not only thinking about your medications, but also where you're going to get those medications.
And Adina, how do you find people are in general right now about knowing what they need to do and trying to start to navigate this or continue to navigate the situation? Because again, as I've been mentioning, we do know that the population is aging and just more people are moving in this direction.
Yeah, and I think there can always be more work done, right? And I think that's definitely the role of a lot of patient advocacy organizations, is to make sure that that information is getting out there. So for example, one thing that we've been doing is we had a video, it's 3 minutes long, and it talked all about these changes, this cap, and what we've called it smoothing, or the Medicare Prescription Payment Program. And we've run that as PSAs, we've run that in both English and Spanish. And so I think it's really a joint effort between the government and private entities like patient advocacy organizations to make sure that people have the information they need. And it's not just older adults that need that information. There are so many of us that take care of our parents or grandparents and have helped them doing that enrollment. And so it's a complex system. And so wherever we can find inroads to make that easier, I think it's important.
Related to that, Tony, on caregiving, we did a segment recently related to that, and there is a lot that people have to know about, and it isn't just, as you just mentioned, the fact that people are older, but there are people that are younger that are taking care of family members increasingly. And I wonder, you touched on that a little bit earlier about some of those changes, but it's good for people really of any age to start getting familiar with all these topics.
Yeah, absolutely. We always say at the National Alliance for Caregiving that caregiving hits you at moments when you least expect it. So it's really important that people are aware of the changes that are happening. And I think that public awareness campaigns are so crucial and important in this. Whether it's from the government or advocacy groups or other initiatives that are making sure folks know what's going on. And we see that with the National Health Council as well as the Alliance on Aging Research, who have put out incredible PSAs. And within the National Alliance for Caregiving, we're making sure that our membership knows what's happening, as well as pushing advocates to make sure their stories are told and their voices are heard on the impacts of these changes, and making sure that those get to CMS so they understand where things may need to change in the smoothing process as we continue on.
Okay, and we'll get to some of the issues, including the cap as well as the smoothing. But before we get to that, I wanted to just come back to the PDPs, the prescription drug plans.
Mm-hmm.
The number overall of those plans has actually dropped. However, they seem to be very available, obviously. It's just that the system has been tweaked. I wonder if you could touch on that a little bit.
I can. It's rather complex. I think there has been consolidation. There has been some incentives that have brought together the number of plans available. And you're right, they are still very available and all of that. But again, I think as we have fewer plans, the choices are different. Mm-hmm. They may be, you don't have quite as many options as you needed to. You still have very good options, recognizing that. But making sure that people understand changes that are happening, what it means that there were 5 options last year and there's 4 this year, what that actually means for me as an individual, and what it means for your specific drug. I think it was great to reference Plan Finder and going in and having your actual drug and seeing what it means in an individual plan. We are working to make sure that in Medicare that beneficiaries continue to have choice and continue to have options that lead to affordability and access, because that is a concern.
And I know that it varies from state to state, mm-hmm. and I don't know, Julia, if you can touch on this as well, but my understanding is that Maryland has roughly a dozen PDP plans, and so for people that may see something that says, oh, there were X hundred of plans last year and now there are only this many, it's still very available, right?
Yes, we've seen a slight reduction, but there's still a lot of different options, which is good. It's important to check service areas because typically a Part D plan will be available across the state, but this year we've seen that there are some plans that are no longer available in certain areas. And just to piggyback off my colleague here, with that reduction, while there's still choice, there are some financial assistance programs that help pay for the out-of-pocket costs of Medicare. So with extra help, it's a little bit complicated, but a lot of times you can end up with a $0 premium because extra help will pay for that. But with some of that reduction, we're seeing less plans that will offer that $0 premium because it's up to the state level benchmark amount. So anything that's over that amount, the beneficiary then has to pay.
Right, so just another reminder that people really need to kind of stay on top of these things, right?
Yeah, I was going to mention the extra help program too, because I do think that's really important. That is one of the areas where we've seen more issues than others. And making sure that people who are in that kind of category, that we're advocating together to make sure that we continue to have as many options as possible.
And these are low-income subsidy plans,
Low-income
right?
subsidy, it's also known as extra help.
Extra help, yeah. And it seems it's been expanded a little bit?
A little bit, yeah.
Mm-hmm.
The people who are eligible, because of the IRA, there's a higher threshold to be available for that.
All right, well, related to getting into some of the changes, we'll talk to the biggest change probably, and that's a cap in our next segment. Well, one of the biggest changes, perhaps the biggest change as we come into this, is what happens with Part D and the cap. and there is a $2,000 cap now, which is extremely important, extremely impactful. And Adina, why don't we start with you, and if you could explain to us a little bit of what that is and how it works.
Yeah, absolutely. So the cap is on out-of-pocket expenses, and it's the $2,000 cap, like you mentioned. That's what it will be in 2025, and in subsequent years, it will grow with inflation. And essentially, it's really going to benefit a number of people that have those kind of higher drug expenditures. We know that in 2020, 1.4 million people paid over $2,000. In that year, and the average it was around $3,300 that they were actually paying. And so it's not every Medicare beneficiary that's going to hit that cap and that it's going to impact, but it will make a huge difference for the beneficiaries that it does. So that savings of $1,500, more than that, depending on the person. And that's automatic. What's really nice about that is you don't have to enroll. You honestly never really have to think about it. It's just when you hit that $2,000 threshold, your expenses will end for the year.
All right, and Julia, could you maybe add to that as far as what people would need to do logistically to avail themselves of the cap?
Yeah, so as my colleague here mentioned, it actually is just built into Medicare Part D. So this is now just the structure of how the payments will be. So it'll be, when you show up at the pharmacy, you're going to be paying up until your deductible, if there is a deductible on your Part D plan. So this is the amount that you're paying out of pocket until your plan starts sharing some of the costs. And then you'll have the initial coverage phase. Well, you'll pay a much smaller portion, and they'll cover a good bit. And then once you reach that $2,000 cap on covered drugs, so it's not necessarily for all drugs. It's drugs that are a part of the plan's formularies, the medications that the plan decides to cover. So once you pay that $2,000, you have zero cost for your medications beyond that. And it used to be that there were many different phases, and there was it was very complicated, and there were different percentages of cost sharing for the beneficiary. So now it's much more simple. You've got your deductible, the initial coverage phase where you're paying a reduced amount but still a portion, and then once you reach that cap, it's zero from there.
All right, and obviously, Tony, this has a great impact on people that are involved in caregiving and trying to get prescriptions for people that they're caring for, or the people themselves that are getting them. What are your thoughts on it?
Yeah, so we know that 78% of caregivers are incurring out-of-pocket costs to care for loved ones, and that often includes prescription drugs. So this financial relief of a cap essentially relieves the financial pressure from caregivers, so they are not worried about not necessarily just managing their loved ones' prescriptions, but also their prescriptions. So I think the relief of financial strain is huge, and I think that this is an automatic benefit as well is massive. We know that family caregivers are busy. They have a lot of different responsibilities in addition to caring for their loved ones, work, and other different aspects of their life. So the automatic aspect of this is really, really crucial and important.
And related to that, Jennifer, you mentioned earlier that you've seen a variety of changes in Medicare over the years. This does seem to be a really big change.
It's huge. I think for many of the people that, particularly those that live with chronic diseases and disabilities, we hear a lot of folks who are in Medicare now who have aged in, who talk about the fact that I had my drug under my employer-sponsored care, and like many of us who have employer-sponsored care, you have a cap at some point, might be high, might be low, but there's a point where you know you've maxed out. And so I paid $800 a year for my, rheumatoid arthritis medication for many, many years, and then I moved into Medicaid, and all of a sudden I was paying $7,000.
Wow.
And the thought of going back to being able to have a manageable, even though I fully recognize it is still high for many, many people to be able to manage that, there is an expected, predictable cap, is really pretty life-changing. Again, I've been around a while. I remember when Part D started and the ability to have drug coverage under Medicare, how big that was. This feels very similar in that. I do want to emphasize what Julia was saying about working on covered drugs. Mm-hmm. So making sure that even though open enrollment is closed now, one of the things we've been saying to people through open enrollment, and I know everybody around the table has too, is it was really the time to make sure that the plan you chose had the right drug and the right formulary and right coverage level.
And moving forward into this year, of course, another big change is the Medicare prescription payment plan, which is also known as smoothing. And I'll open up to any of you, but we'll kind of go down the line here. Why don't we start with you, back to you, Adina, about what that impact could mean in terms of kind of easing the pain of paying for these prescription drugs.
Yes, so many people have, and I think Julia was kind of alluding to this, at the beginning of the year they have significantly more costs than they'll face at the end of the year, and part of that is this cap that's forthcoming, but there's other reasons for that as well. And so essentially what the Medicare Prescription Payment Program, MP3 we've been calling it, or smoothing, what it does is it allows you to spread out your costs evenly every month over the course of the year. And it's something that you enroll with your plan. You can enroll anytime throughout the year, but of course if you enroll in July, you can only spread your costs over 6 months versus January 12 months, right? So there is definitely incentive to enroll earlier on. And you have to enroll with your plan 24 hours before you pick up your first prescription. You can't enroll at the pharmacy counter. And then essentially what you'll do is you'll go to the pharmacy counter, you won't pay anything, and then you'll get this monthly plan billed to you this monthly bill from your plan every single month. And so, people need to be thoughtful about if this is something that will actually benefit them. I kind of think of it as like a Klarna type service, something where, you're spreading your payments over time. There's no interest on it, which is fantastic. But it's something where, you want to make sure that that's the right thing for you.
Right. It doesn't necessarily lessen the cost, but it spreads them out.
It spreads
right?
it evenly.
Yeah.
Exactly.
It gives you predictability, and I think Julie was talking earlier about being on a fixed income. It allows people to plan and manage that. I think there's a couple important things to add what Adina said is, if you fill a prescription in January and opt to spread that through the year, divide it up by 12, and then you have another prescription in July and divide that up by 6, those get added together. So you still have, you still have the $2,000 cap, but just because in January they say it's going to be $200 a month, it may be $250 by the time you get to the end of the month. So people need to plan for that. I think the most important thing about this is there's a lot of information going out to folks, either with high prescription costs or mostly with high prescription costs, to make sure that they know about this and get involved. But I really want to one of the things that we at NHC are trying to do is make sure that kind of everybody knows about this. Because really, depending on your own financial situation, it may or may not make sense for you. And sitting with your family, sitting with your provider, sitting with your own financial situation and figuring it out is probably the most important thing to this. It's complex but simple at the same time. So that's really important because there are folks out there for whom it might be preferable, might make life a little better. It's not a matter of I can't afford my drug or can, but maybe I've got a vacation coming up, a holiday coming up that I want to, spread my costs out a little bit so I can manage that. There's lots of reasons you might want to avail yourself of this, and so making sure you know about it and that it's available to everybody is important.
And Julia, would you like to add? I know we've covered a lot of the issues related to the smoothing, but just what people maybe should need to know as we move forward into this year.
Yeah, well, just to add, there are now some new tools that you can use to see if it will actually benefit you, because there's a bunch of different scenarios, and so you can plug in your medications and actually sort of anticipate what those costs might be month to month and see if it will benefit you. And I will add, too, that there's, just to reiterate, Extra Help is a really fantastic program. If you're hearing about the Medicare Prescription Payment Plan and it's something that's new to you, and Extra Help is maybe a concept that's a little bit new to you, it's good to ask to see and look into that program, talk with the SHIP counselor to see maybe if Extra Help you might qualify for Extra Help, because that actually will reduce your out-of-pocket costs instead of a program that makes the costs more manageable. So two things. One is checking to see if the Medicare Prescription Payment Plan will benefit you, and two, first actually seeing, do I qualify for Extra Help? which has some additional benefits.
I would add, at the National Health Council, we've created, in addition to kind of the federal and state tools, we have an interactive infographic on our website that allows people to answer a series of questions and lead them either to extra help or, yes, it looks like you might want to benefit from the Medicaid prescription payment plan, or it looks like you're okay, the cap is there for you, enjoy it, but know that the prescription payment plan is. So it's a very short series of questions that lead you to help make those decisions with your family and others. So I just encourage you to go look at that. And I know Alliance for Aging Research and others, we have that on our website actually, is a series of explainer videos to help people understand. We took the federal information and put it in one place in order to have that, because there's a lot of good information, but everything fits together in a way that will help people, I think.
Yeah, the Alliance for Aging Research, we have loweroutofpocketcosts.org, which is very similar to what Jennifer was talking about, but it's all of these resources kind of compiled into one place. And Julia, you mentioned a SHIP counselor, and I think that's an incredibly important resource that people have, and I don't know that everyone knows what that is. Do you want to kind of talk about it a little
Yes,
bit?
thank you.
Yeah.
So the State Health Insurance Assistance Program is, it's actually available in every single state. So I'm from Maryland, and it's run by the Maryland Department of Aging, and we work with a bunch of our local area agencies on aging. So we have trained Medicare counselors in every county. Every state's program looks a little bit different, but if you go to help.org, you can find the number for your local SHIP office if you're in a different state, and speak with somebody, whether it's about plan comparison, learning about some of those subsidies and screening and helping get some application assistance potentially. Maybe there was a denial of one of your claims and you'd like help with an appeal. So really a lot of those Medicare questions where you're not really sure where to turn, you can turn to SHIP.
Well, that's great information, and Tony, I know from your perspective and the caregiving perspective, it's got to be very important not only for the patient themselves to know about some of these things, but probably even maybe more so for the caregiver, depending on the condition of the person that they're taking care of.
Oh, absolutely. And this is something I saw firsthand in my family. One of the things that caregivers take on very often is the financial planning component. So having more resources for caregivers, like the smoothing process, to be able to plan budgets more effectively and avoid upfront cost, upfront financial shocks is really crucial. And the piece about this being opt-in really emphasizes how important organizations like the National Health Council and NAC are with ensuring that caregivers know about these resources and know about these policy changes. Because we want to make sure that people have the opportunity to opt in. Because as I said before, caregivers are very, very busy. But knowing that there are resources to help you plan ahead is really crucial.
Right. It's almost like you have another full-time job if you're already employed. I've spoken to caregivers, and it's just incredible what caregivers do.
Absolutely. We also know that caregivers contribute over $600 billion to our economy. So it's another job in itself.
Yeah, really amazing. All right, well, we're going to take a look at the future of Medicare and some of the other issues, as well as kind of circle back to some of the things that may be helpful to you as you navigate all of these changes in 2025 when we come back for our final segment. All right, well, we've talked a lot about the major changes to Medicare and Part D, and it certainly can be overwhelming, and I know that there are some concerns about that people obviously have when they get into this, that it's not as easy as clicking on something and finding out, oh, here's how it works, and then you just jump right in it and you get your benefits. I wonder if you could talk about some of your concerns.
You mean in terms of the protection payment plan, or just broadly?
Yeah.
Okay, yeah, absolutely. I think there's, again, as I said earlier, this is a very significant change and a very significant kind of moment in Medicare, I think, with the changes that are coming and being implemented right now. And as we have seen with previous Medicare changes, there is always potential for pitfalls, things we need to be watching for so that we can correct for, and want to make sure that everybody kind of understands that. I think this is these changes will have impacts on lots of things. One of the things that we are encouraging people to really watch for is to make sure that access and coverage levels kind of maintain themselves where they should be, and making sure that they are sharing with National Health Council, with others, with their SHIPs and others when things look off. Because we want to make sure that we are collecting that information and feeding that to CMS, to Congress, to others, to kind of, as with any new thing, it's going to need tweaking here and there. There are going to need to be things that need to be addressed. And so encouraging advocates and the public in general just to kind of, if you see something that looks slightly different, good, bad, indifferent, it's good to talk about it, to share it. SHIPs are a great place to start because you guys do kind of collect and feed that information up, I know. But really, everybody's kind of all hands on deck on this. So advocacy groups, CMS themselves, all are interested in hearing about some of this.
Yeah, I've talked to members of Congress who have acknowledged that whenever something gets approved by lawmakers, well-intended, invariably there will be something that was part of the legislation or some kind of secondary impact that will happen, and the only way that people can know about it, including the people that ultimately make these decisions, which it ultimately comes back to Congress, is for them to get that feedback and to know that, hey, while you thought this was going to do this, it's actually having this impact, and I'm sure that's got to be a concern. And do you find that people sometimes thought that something was going to be covered and then it wasn't, or perhaps couldn't get the prescription that their doctor originally said that they should, and they might have gotten, moved to another one?
Absolutely. I think that happens to people under all kinds of insurance. We've all experienced that one way or the other. I think it stands out more in the Medicare space because you have a population who are older, might have more chronic diseases. It has more impact when you have that situation happening. The involvement of Medicare Advantage and private insurance in the Medicare space enhances that a little bit. But I think that there is very well-intentioned unanimity around the idea behind these changes is to increase affordability for beneficiaries, to not decrease access, and to create a system that works better for the individual beneficiary. So the more we are all sharing that information, working towards that goal, the better it will be. Sounds a little Pollyanna-ish, I think, but it's true.
Well, and Julia, you were mentioning that, not surprisingly, you and other people get a lot of questions about whether these changes are going to change the impact on what people are paying.
When a new program is implemented, as we're saying, there's always curious to see what will be the flip side. And I think that the Center for Medicare and Medicaid Services is trying to anticipate some of that. For instance, if for your Part D plan, if you don't pay your premium, you can be disenrolled from the plan, which can have long-term repercussions because you don't have your coverage, and also you can end up with a late enrollment penalty. But this plan is actually entirely separate. So, and there will be a separate bill, so beneficiaries should look out for that. But if they fail to pay the required payments for the prescription payment plan, they will just be disenrolled from that plan. It won't impact their enrollment in their Part D coverage. But I will say there are. We hear about frequent concerns in terms of where will the costs be offset? Will my premiums go up? Will there be changes to the formulary where my drug is no longer covered? And right now we're seeing that premiums are still affordable. Beneficiaries are able to find a plan where their prescriptions are covered. But there's always that concern down the line of how things will evolve.
Yeah, and Adina, you had mentioned that people don't necessarily have to just kind of throw up their hands and accept, like, oh, well, this is what they're telling me, that there are avenues for people to try to figure out, okay, how do I either correct this or just even understand what is happening in terms of what they're paying?
Exactly. There is an entire division within Medicare of people who just read appeals. That is their whole job. And so I do want to make it really clear that if something requires a prior authorization from your doctor, or requires you to fail first on a less expensive therapy, or potentially you want to take a medication, it's flat out denied, there is always an appeals process that is available to you. And there are all kinds of groups. I know Julia mentioned with the SHIPs do this work. There's also patient advocacy organizations that do this work. And I just want to emphasize also what Jennifer was saying, which is, there is nothing more powerful in advocacy than the patient story. There is nothing more powerful than somebody saying, this is what happened to me, and this is what caused it. And so that alliance between the patient advocacy groups and the patients themselves is so important, because we know who to take your story to, right? And we know, nobody is defenseless. And I totally agree. We don't want to scare people, right? I think a lot of these problems are, nobody's ever going to see them. But if that ever does happen to you, there's avenues to work forward.
Right, and I would assume, Tony, that would be an issue that sometimes comes up with caregivers, that they're working through all this paperwork or making phone calls or doing all these things on behalf of mom, dad, sister, brother, whoever it might be in their family, and finding out, well, what's this about, or what's this about? And that must be kind of a big learning curve for people.
Absolutely. It's complex, and then in addition to all of your other responsibilities, it can be really challenging. But I just wanted to also emphasize the advocacy point. That's something that's really important to us at the National Alliance for Caregiving, is we work to collect caregiver stories as well as those they care for, to help explain where there might be some challenges within some of these policy changes that are occurring, and helping caregivers tell their stories and reach out to their elected officials and reach out to agencies. And again, acknowledging that caregivers are busy, we try to make that as easy as possible for them by creating templates and different ways and different avenues to make their voice heard.
Right. We interviewed recently an individual who had, as most caregivers, had no experience, and then suddenly things happened with their parents, and he said, suddenly this became my second full-time job, and he had to start learning about how to navigate the prescription rules and the guidelines, and it is quite a bit to learn, right?
Yeah, absolutely. But I want to emphasize, I think that if you hear one thing around the table, is that help is out there. From all of us, from CMS, from others, that in itself can be hard to navigate, where to go for help, but help is there. And I think there's a real interest. I think people have more attention right now than they've ever had to pointing out issues that are out there or experiences or telling their story, because we're in a period of change. This is the time when people are watching and listening and hearing. So it's time to speak.
Yeah, and Adina, it does seem like that there is as you mentioned earlier, these various resources. There does seem to be a growing awareness, as Jennifer mentioned, among people that, again, we don't want to scare people, but at the same time, there are some challenges. But at the same time, there are an incredible amount of resources for people to rely on, and as well as the advocacy groups.
Yeah, absolutely. One thing that's great about the internet, right, is that this has become a collective consciousness thing. People are thinking about their drug coverage. They're thinking about, helping each other. And yeah, absolutely. I think this level of heightened awareness can only be positive, right? And so, I think Jennifer and Julie did a really great job of laying out kind of where you can go. But I also want to emphasize, all of these changes that we're talking about are overall really good, right? The cap, we're also excited about that. The smoothing is going to help a lot of people. So I think, overall we're in a positive space, and where those negative kind of branches come out, there's options.
And you mentioned giving feedback on what works and what doesn't. I assume as we move through this year that we'll find out some of those things, and that it is important for members of Congress and policymakers and others to know about this.
Absolutely. I think we're working very hard. We were talking about some of the tools we put together for open enrollment and things like that. We're working very hard with our communications departments and other departments. And it's kind of interesting from the advocacy side, because we all know that we're going to hear about this in June, July, August. We're going to be hearing about this throughout the year, the impacts of these changes, and particularly the Medicare prescription payment plan. That first time, I'm very interested in what happens that first time somebody is at the pharmacy counter and the pharmacist recommends it, but says you need to go back, contact your plan, come back in 24 hours. We're all working very hard to push for point of sale, that you could register in the moment, or at the very least step to the side, call your plan, sign up, step back to the pharmacy counter. There's actually an open comment period right now that is asking for input on exactly that, on getting rid of, how can we change that 24-hour turnaround time and make it real time. So CMS has that out. I think they're due January 27th. But yeah, it's going to be a year of information collecting. It's going to be a year of trend tracking. But I do think it's going to be interesting because we are going to be hearing about this throughout the year, because even those good stories of when people hit that cap, people are going to be surprised. I mean, there's still a lot of people who have no idea of these changes. And that first time they go to the pharmacy counter and they say, you've hit your limit, your bill is $0, that's going to be a good moment. But I don't think people are going to know it till they're in it.
Right. And one thing that we haven't talked about, which I know that you all know is unfortunately fairly common, is the fact that some people, because of the high costs of some prescription drugs, they've literally not taken their medicine. Absolutely. And they've tried to only take a certain amount. And I wonder, and I'll just open up to any of you of what kind of things you hear related about this, and how on the flip side, on the positive side, this cap could help avoid that very rough situation.
I think lack of adherence, that's what we call it, is really common, right? Somebody, they're prescribed a drug by their doctor and them have decided this is the best course of action. They show up at the pharmacy counter and they just can't take that cost. And so we know that drugs are, I'm forgetting the exact statistic, but it's very common that drugs are just abandoned at the pharmacy counter and not picked up. And that's really concerning, because we want people to have the best possible treatment. So many things are, if you start to treat it early, right, it can be a better outcome than something there if you let it fester or let it wait. And so absolutely, I think that these changes are going to help to make sure that not only people are taking their drugs home, taking them exactly as prescribed, which is incredibly important, but also, feeling less financial burden as a result.
Yeah, and I would think from a caregiving standpoint, if somebody knew a loved one was doing that, that would be pretty heartbreaking.
Absolutely. We hear stories about people having to ration their medication all the time, in particular caregivers having to make the choice of whether they help a loved one pay for their medication or they take the medication themselves. So we really see this cap as well as the smoothing process as a great step forward to making sure that caregivers improve their medication adherence. And if caregivers are well taken care of, that has ripple effects on the person they're caring for as well.
Well, obviously a lot of changes coming. You were just going to add something.
Oh, I was just going to say, I think one of the important things is getting the word out early about having conversations like this around the cap, because there will still be people who will have trouble affording that $2,000 cap, but there are many for whom that will be the difference between whether they're able to adhere to their medicine as prescribed or not. And if they know that cap is there early and often, they won't be making those decisions early in the year thinking that the $400 bill I got in January is going to continue throughout the year. That if I know I'm going to hit that cap, I might be able to plan better and get through those first couple months, adhere to my medication, and then have the rest of the year to really stick to it. So making sure that people know that they have that option and that is available to them coming is really important, even before they hit the cap.
And just picking up on that point, to kind of bring it all full circle, I'd just like to go to each of you, and we can cover some of the ground that we've talked about, but I think it's really important that people know about these resources, to be thinking ahead, as you mentioned. And I'll start with you, Julia. What are some of your final thoughts here as we move into 2025 about people thinking about these issues that are obviously so very important to their health?
Well, one thing I would like to highlight is, even though we're past the Medicare annual open enrollment period, we are getting into the Medicare Advantage open enrollment period and the general enrollment period. So if you missed your initial enrollment period starting January 1st to March 31st, you have an opportunity to enroll in Medicare and make some plan selections. Or if you enrolled in a Medicare Advantage plan, but you see one of your providers, or you find out that one of your medications actually isn't covered, you have some opportunity again January 1st to March 31st to make some changes to your Medicare Advantage plan. Not with the Part D plan, if you currently have a Part D plan, but coming up there's some more opportunities to make some changes to your coverage.
Very good information. Adina?
I'm just feeling very optimistic as a result of this conversation. I mean, I think these benefits are going to make a huge difference to a lot of people, and also there's so many people that are on everybody's side, right? They're on the beneficiary side. It's a bipartisan thing that everybody wants to get control of these drug costs, and so I just think it's great that you can turn to your patient advocacy organizations, you can turn to your SHIP, you can turn to your provider who will also help you. And we're moving forward. We're getting steps in the right direction.
All right, and Tony, some final thoughts from you?
Yeah, and I feel similarly. I think these are big steps in the right direction, but I think it's important that, speaking from an advocacy organization, we continue to push for making sure that caregivers and care recipients' voices are heard throughout this process and this conversation. And just would like to also emphasize the importance of, we talk about networks within caregivers very often, making sure other caregivers know about these resources and know about these changes. Word of mouth is really, really important in all of this.
Well, it's great to hear this optimism. Any final thoughts, Jennifer?
Just echoing what everybody said, really, again, we are very excited about these changes coming. We think they will highly benefit beneficiaries in their affordability and in their access. These are things that we have fought for years and years to make happen. So to see them really happening and to be in this moment is significant. There are resources available. All those around the table. The National Health Council website has a full suite of resources to help people navigate some of these decisions and spread the word.
All right. Well, this has been a great and very important conversation. I'd like to thank all of my guests. Tony Gingerelli, the Director of Policy and Advocacy for the National Alliance for Caregiving. Julia Schreiber, the Director of the State Health Insurance Assistance Program for the Maryland Department of Aging. Adina Lasser, the Public Policy Manager for the Alliance for Aging Research, and Jennifer Dexter, the Vice President for Policy at the National Health Council. I'm WTOP Capitol Hill correspondent Mitchell Miller, and for more on this discussion, visit federalnewsnetwork.com and search Medicare Part D.